A couple of years ago, COVID redefined our lives, but what we've now come to learn of COVID is that it never really will go away. It's there to remain with us. There are different mutations of COVID which will continue to impact us in different ways. Right now in India, we are seeing a resurgence of COVID. Fortunately, it's not very dangerous. Most people get okay, but the actual numbers perhaps are never quite known. There are concerns about different strains and mutations elsewhere in the world as well. Uh, Dr. Eric Feigl-Ding has been at the forefront of spreading understanding, knowledge of COVID and also other infectious diseases, how it impacts any number of people across the world. I've spoken to him many, many times in the past, but it's wonderful to speak to you again, Eric. For starters, this strain of COVID that we are now seeing in many parts of the world, is it essentially the same strain, or are there variations within the strains that we are seeing, where, as a result of which we're seeing this uptick?
Yeah, we're definitely seeing new strains all the time. And this is just the latest iteration, this MB181 that's seen in India, seen in China, and seen in Europe as well as the US. We haven't really identified whether it's truly that much worse. Some say it is more contagious, but that could just be because that we have waning immunity since it's been a while, over a year since the last big wave. And in many ways, we know that the immunity against these COVID strains does not hold, or small mutations allow to pole vault over our previous immune systems against past strains. So whatever the reason, it is spreading pretty quickly, but we're not seeing the massive surge in hospitalizations and deaths that we've seen in the past waves. So maybe we'll get lucky, but this is a good reminder that it is definitely still with us, and many vulnerable people are still susceptible. And even if you don't have acute hospitalization, you will have long COVID. That's been pretty documented, even if you don't have high risk factors.
Dr. Feigl-Ding, let's try and break that down. Do you have any numbers or statistics on the massive upsurge or the uptick in the United States or any other parts of the world?
Well, China had a relatively big wave, but we don't know how big. We know in Hong Kong that there was a surge of cases. In the US and Europe, it's just a handful. Right now, it's showing up in wastewater systems because that's the main way we're seeing it. But the spike is not an astronomical spike. It is an uptick in many parts of the country, but it hasn't taken over as a dominant strain yet. There's other dominant strains, but it hasn't become this overwhelming strain that has taken over the country. But it could just be a matter of time, because at the same time, other than wastewater, we almost rarely ever test for COVID anymore. And usual conventional tests, we don't know what strain it is. So we have to, in so many ways, wait and see. And in the US has taken under Trump administration, test no evil, see no evil, hear no evil, because the CDC has been decimated, as well as the rest of the health department under Trump administration.
Let's try and get a few more details about this strain of COVID. How does it impact people? What are some of the symptoms?
Well, the symptoms are similar as before. There is the coughing, fatigue, fever. It's the traditional COVID symptoms. But the issue is that your body has not been adapted to the new strain. So you get sick again. And the long COVID thing, what I was referring to, and I want to emphasize, is that even if you get better relatively quickly, these brain fog, these lung damage and increased cardiovascular damage, we know stays with you even if the acute infection of the COVID is gone. And we see this with other strains in the past. So we have to presume that it is existent with this new strain. It's just that because your previous immune system wall is being pole vaulted over by these new mutations, you're going to be susceptible to it again. And the long COVID, we assume, will carry over again, because 1 in 3 people who get infected will get long COVID of some sort. And these symptoms of this overall tiredness, brain fog, and increased cardiovascular risk carry on 6 months or more after the infection is over. So people have to realize that it's not just the initial infection. These long-term sequelae will follow you even for 6 months to a year.
What do we do in terms of vaccinations? I do know that, I mean, there's been some thought over here about the inevitability of people getting a booster shot once again, or perhaps an altogether new vaccine. Is that something world over people need to start thinking about? It's been a couple of years since we've seen the worst of COVID.
Yeah, we do need updated boosters, and we should have annual boosters against the latest strains. But the issue sometimes is the mutation comes out after the previous strain was already selected earlier in the spring, and then a new mutation emerges in the summer, like right now. And we hope and pray that the booster we selected is close enough to the new strain. Honestly, we need a new generation of vaccines because these injection-based vaccines, they protect you against hospitalization, but they're not good against infection, like preventing the initial infection. For that, we need basically these mucosal nasal vaccines. These either ones you spray up your nose or you inhale, like almost like an asthma inhaler. And these nasal mucosal vaccines that you inhale can actually prevent the frontline infection in your mucosa and in your respiratory tract way, because that's what will prevent longer infections. And we have some in development. It just the worldwide attention on these COVID vaccines has waned, but there are groups out there who've been developing them. Actually, China uses one of them. It's the CanSino vaccine that you can directly inhale, not the old one that you inject. But it's not available worldwide, and it's unfortunate. But there is more promising next generation vaccines that you can inhale that protects you against infection, not just hospitalization and severe disease.
Now, this is referring to what the Health Secretary of the US, Robert Kennedy Jr., has done. He's taken the step of firing the expert panel that advises the Centers for Disease Control and Prevention on immunizations. They say that the action which is needed, that action is needed to restore faith in vaccines. Now, over the years, both you and I have spoken in favor of vaccines. I've seen in India, it saved countless lives, tens of thousands, perhaps hundreds of thousands of lives. Therefore, when in the United States, you see Mr. Robert Kennedy Jr. make these statements, I mean, are we deeply, deeply in trouble with this?
Oh yeah, the US right now, the entire public health system is being burned to the ground because RFK Jr., before he was Trump's health secretary, which is very scary sounding in itself, was actually the king of anti-vaxxers. He founded a nonprofit focused on vaccine disinformation, and it was the largest organization on vaccine disinformation ever. And he's been widely discredited on vaccines, debunked many times. And he actually promised at his confirmation hearing to be health secretary that he promised the senators that he will not remove or change CDC immunization guidelines or this committee of scientists. Yet yesterday, he did exactly that. He basically fired all 17 scientists on this vaccine committee, even though he previously promised he would never do that or give notification to Congress before he does anything like that. So he's broken every promise, and he's most famously the founder of the largest anti-vaccine group. So this is not a surprise, but at the same time, this is very scary because 2 weeks ago, they've also limited vaccines against children and pregnant mothers when pregnant mothers definitely are high risk. And they went around all the CDC scientists to do so. And of course, the Elon Musk's Doge has also fired, over like 10,000 employees from the health departments. So the US, FDA, CDC, NIH, all these places that do medical research and public health prevention programs are being basically systematically wiped out under this anti-vaccine leader. So it's very, very scary. And disinformation has an iron grip on the US health federal health agency, unfortunately. And many times we have to turn to other countries. Many scientists have to say, no, 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 don't look at CDC anymore. Go follow European guidelines, follow Australian guidelines. It's very sad in many ways.
A final question. There have been multiple reports now, I think 3 reports, of packages coming into the United States from China containing concealed biological material. That by itself is illegal. I mean, you can't import anything that you like in terms of biological material. But is there a concern that this could be that this might be brought into the United States, to pursue research on a bioweapon or something along those lines?
That's just speculation. Honestly, I don't like the bioweapon topic in itself because many times we're just wildly speculating with no evidence whatsoever of bioweapon. Bioweapon claim it's a very high bar. Making claims of bioweapons is a very high bar. It's kind of saying you know about aliens whenever you don't have proof. You can't make those claims without hard evidence. Now, sometimes people import the samples like from plants or some other animals by accident, and they forget a permit. There's an incident where one Harvard scientist accidentally brought in a sample for her lab research, and it wasn't anything related to a virus, but she's being deported because she's a foreign scientist for that. But that was not related to bioweapon at all. Just because you're bringing in any biological sample does not mean it's related to a virus or bacteria bioweapon.
All right, wonderful speaking to you, Eric Feigl-Ding. It's great to have you back on NDTV and sharing your thoughts on what remains a huge global concern. Thanks very much indeed.
Thank you. Stay safe.